There's an article that came out in Emergency Management, Preparedness and Recovery, and it's dated November 10th, 2017. Health officials, opioids, a modern plague. Isn't that what we've been saying? So let's get into this article. 2 Missourians a day die from an opioid overdose, and 2 babies a day are born addicted to narcotics, state officials say. Dr. Randall Williams, a director of the Missouri Department of Health and Senior Services, said the opioid addiction plague has been called a modern plague. That's amazing. I believe that to be true, he said. He spoke Thursday at a conference of healthcare and law enforcement experts where a federal drug enforcement administration agent said 700 Americans a day fall into opioid addiction. Wow. That's the first I've ever heard this about people getting hooked on opioids every day. 700 a day. Wow. This is why they're never going to stop it, y'all. You add that number up, that's astronomical. And you have, just from looking at the documentary that I post, a lot of these people have been doing opioids and heroin for like 5, 6, 7 years. Been on it for quite some time. Missouri's problems run close to the national average, and although methamphetamines remain the biggest problem in East Jackson County, opioid addiction often started with legal painkillers, but drifting to heroin and even more potent drugs is on the rise. Williams praised Jackson County for efforts such as the prescription drug database that it helped start, aiding doctors trying to screen out patients complaining of pain just to score a prescription for more drugs, such as oxycodone. But he added, what we're doing isn't getting us where we need to be. Speakers outlined a series of challenges. Too few addicts seeking and getting treatment. I told you that. You know, the vast majority of the addicts are not seeking help, ladies and gentlemen. I've been saying that for a long time. The few that do seek help, trust me, that is in the most smallest percentage. Too few sober living homes for those in recovery. Too little education from doctors on pain management. A hospital evaluation system that gives doctors incentive to be aggressive about pain instead of cautious about addiction, and too many gaps in care between the ER detox and the next stages of treatment. And one more, as a society, we don't deal well with life's tougher moments when we should fall back on our own strength and resilience instead of a pill. Yeah, right. Not in America. We are a society that doesn't want to deal with pain, says Dr. Michael Peterson, Chief Medical Officer of Accenture Opioid Epidemic Solution. Huge problem. Doug Dorley, a public information officer at the DEA regional office, said, this is the worst drug plague in U.S. history. He said 25 million people, 1 American out of 13 abuses drugs. That's a lot of people. Okay, that's a lot of people. Although meth remains the most prevalent drug, it is everywhere, Dorley said. Prescription opioids and heroin are rising quickly, I'm sorry. Heroin is often made worse with the addiction of fentanyl and carfentanil, which make for a higher high and put the user far closer to an overdose. There is a huge problem in the Midwest. Whatever the national stats are showing, we're seeing, Dorley said. Here's how potent and deadly fentanyl and carfentanil are. The police have stopped doing field tests of white powdery substances. Those are sent straight to the lab because the danger to officers is too great should they come in contact with those substances. And remember, if they just inhale the substance, they OD, or particles are in the air when they go on a drug bust. And dogs can't even sniff that stuff because it kills the dog. 90, well, this is not right. 91 Americans are dying. No, it's like 175. At least that's the latest number they gave. Dr. Angeline Stanislaw, chief medical director of adult services of the Missouri Department of Mental Health, citing figures from 2015. She stressed that the crisis affects all strata of the society. She said Missouri had 908 opioid deaths in 2016, up 35% in a year, and 377 of those were from heroin. Prescription opioids such as oxycodone came into the market 21 years ago, Stanislaus said, initially intended to treat such things as end-stage cancer. Pharmaceutical companies pushed them hard, making the pitch to doctors that they weren't overly addictive, she said, which is a lie. Also, medical standards have shifted since the recognition of pain management as a separate discipline 4 decades ago. Now, those drugs are prescribed for a wider range of pain, not just end-of-life scenarios. Speakers on Thursday said it's often hard for doctors to know if a patient truly needs help for pain or is trying to get a bottle of pills for his own addiction or to sell easily on the streets for 4 figures. There is a very real crisis in how to treat patients, said Darren Ghosting, Dean of Medicine at the Kansas City University School of Medicine and Bioethics. Even today, he said, only a handful of medical schools have a curriculum that links care with management of chronic pain. I think this is one of the major gaps, he said. Speakers also said patient evaluations, literally the emergency room evaluation form that has patients rate their pain experience by marking somewhere on a scale of happy and sad faces, add to the problem. Those evaluations affect reimbursement rates and puts pressure on administrators to nudge doctors to no pain options despite the risk of addiction. Williams said today there are 89,000 opioid prescriptions for every 100,000 Missourians. Tools to help are available. The state has collected many at opioids.mo.gov. Every state but Missouri has a database that allows doctors to see how many other prescriptions a patient has. Jackson County and other local governments have started their own database. It is up to 48 jurisdictions, said County Executive Frank White Jr., covered 71% of Missouri's population. This will definitely help doctors with doctor shopping, said Stanislaw. That's been the big problem all over the country. See, what these addicts would do, they would go to multiple doctors and scream pain and get multiple prescriptions. And they got away with doing that for a long time. until it got to the point where they could no longer get a script. And that's when they went on the streets for the heroin. Other speakers cited higher death figures than Stanislas did. Dorley of the DEA said nationwide there have been 105 deaths daily this year just from fentanyl, which is still new on the streets. Well, I don't think it's so new. Peterson said 38 million Americans, 1 in 9 have substance abuse disorder. That's a lot of people, y'all. 38 million. See, that's a whole nation of people. You could make a whole nation with that number. And see, that's the thing. They're not going to stop this thing, ladies. They're not going to stop it. They can't. They can't. It's too many people. How do you monitor 38 million Americans that are hooked on drugs? You can't. It's impossible. He put the number of opioid deaths at 142 a day, but Chris Christie recently said 175, which he said is basically the equivalent of a commercial jet crash every day. That's how impactful this is, he said. Williams and others said there's usually a downward path of about 3 years from the beginning of addiction to death. Typically, a typical pattern is that a person becomes addicted to something like oxycodone, starts buying it illegally, $80 a pill, and then moves to heroin at 1/4 the price and a stronger high. The truth of the matter is, we have time to intervene, Williams said, but there are gaps from trafficking data to the lack of what Stanislas called a warm handoff of an overdose patient from the ER to detox to rehab. But very few are going to rehab, y'all. Where we lose people are between stops, said Susan Whitmore, president and CEO of First Call. Nicole Dawsey, prevention education coordinator for a group called NCADA St. Louis, said 9 of 10 people needing treatment don't get it. Yeah, that's the majority. That is unacceptable, she said. But you know what? They're grown. You really can't make them go into rehab. Now, the only time you could probably kind of force them into it if they go in drug court. Drug court gives them the option of getting treatment or going to jail. So, but other than that, if it's not that type of situation, you're not going to be able to force these people into any type of rehab. Cameron Lindsay, a professor at the UMKC School of Pharmacy, outlined what she said were key messages. Only use prescription meds as directed by a health professional. Don't share them. Yeah, well, they have parties. I heard about white people having parties where they share pills with each other, drug parties. And they bring all their pills and everybody shares the pills. And they even have parties where they do drug cocktails. They mix all the pills together and take them in a group. Keep them in a safe place and properly dispose of them when you're not using. And model good practices along these lines. Well, she's going on the assumption that the people taking them are not drug addicts and they're just using common sense. You have an awful lot that are junkies and they're going to do what they want with those drugs. She encouraged educators to use resources. I'm going to skip over that. Also, Stanislaus pointed out that the drug naloxone, which first responders carry to reverse opioid overdoses, can now be purchased in Missouri by anyone over the counter. Dorley said education is crucial. Starting at early grade school, kids need to know, he said, that drugs are drugs, whether from a pill or a dirty needle. Speakers stressed the need for prevention and treatment. Listen to this, arresting people is not going to solve this problem. You know what? The next time a Black person gets arrested for drugs, tell the cops that arresting me is not going to resolve this problem. You know, this is just the double standards in this country is just unbelievable. Treatment takes time and persistence. We don't know what's going to work for each person, and we need to individualize it and model it, said Alan Flory, president and CEO of Rediscover in Lee's Summit. Several speakers touched on addiction as a societal problem, something in the way we raise children and the message we send them that needs deep and long-term attention. Sergeant Chris Cessna of the Kansas City Police Department Drug Unit said frontline officers ask users how they got to this point. The typical answer, he said, is that they started using substances just as a matter of coping. So when you can't deal with life, ladies and gentlemen, start using drugs. That's their solution. For some reason, he said, they're broke. William praises the effort being made by Jackson County. It's a clear beacon of light for us as we work on this, he said. But overall, major changes are needed, he said, and he compared it with a wildfire. We've got to stop it, he said, or it will grow. Well, you are a day late in a bug. You're 20 years late. The fire is now an out of control inferno that just can't be contained when you think about this drug plague that's going on in the country. So, ladies and gentlemen, tell me what you think, but I'm really shocked. The article called it a modern plague, and that's exactly what this is. You really think about it. Please leave your comment and subscribe, and don't forget to hit on that notification bell. Peace, family.